up, as we used to say. Okay, it's 1 o'clock. I'm Bill Canada, Custer County Chairman for the Board of Health. It's Wednesday, the November 27th, 2024. And Kevin, would you please silence your phone?
Yes, sir.
And Lucas. Everybody silence your phone, if you got them. The meeting will be recorded on both Zoom and on, what else we got going today? YouTube, okay. Well, I'll call this meeting to order now. Let's do the Pledge of Allegiance. And how about Sarah start it off?
Okay, I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. Okay, let's see if Caitlin can do the roll call.
Chairman Kanda,
Here.
Vice Chairman Day,
Present?
Board of Health Member Epp,
Present.
Board of Health Secretary Caitlin Womack, present.
Okay, and the audience today, at the table we got.
Dorothy Carson, Planning and Zoning, or County Sanitarian in this role.
That's true.
Sarah Bertelson, Custer County Public Health Agency Director.
And in the audience out back front there,
James Gilbert.
James Gilbert. Anybody online? Can you tell you?
Nope.
Okay, okay, and we do not have any, anything to amend on the agenda, anything, Lucas?
I don't believe so.
How about you?
Not here.
I don't have any. And there are no minutes. There will be now, from now on. I've got a full complement. Okay, with that, we've got the reports are coming up, and the first one out of the chalks will be Dorothy. Dorothy, I know you've got some stuff.
Sorry I didn't get it to you sooner. It's been busy. Just to give a quick rundown of the sanitarian report, I was kind of shocked when I counted the numbers, but we currently have, that we're aware of and have confirmed, 38 dwellings / RVs being lived in, cabins with no septics. So far I have sent letters out to all of the,
All 38?
all 38.
Good.
Well, let me rephrase that. I've sent out letters to the majority of them. There may be a few that I have not got the letters out to yet. I do have 10 of them that I've sent over to Dan due to lack of reply.
And how big a period of time are you allowing?
I'm giving them 30 days to at least contact me, and if they don't contact me and give me, come in and at least apply for the permit, I send it over to Dan.
Okay, and you made that clear though, when you did that, just so
Absolutely.
we know for the record that you do tell them.
Yes, and I
30
was
days.
gonna bring with me what I've started attaching to the letters. What I've started attaching to all of the compliance letters has really gotten people's attention. So the very last part of where it talks about compliance in the resolution, and it goes into penalties, I just put a little last sentence on there saying, for your
And if you
convenience.
don't, here,
For your, I've tried to put it nice. I said, for your convenience, I've attached the portion of the resolution that describes the next steps.
Good.
And then I attach those. It costs a little bit more in postage, but the phone has been ringing. So that's been, don't know why we didn't do that all along.
good call.
4 of the properties are listed for sale that have no septic. And those 4 are on Dan's desk. I believe I got something back from his secretary saying that they've already sent out letters to those 4, so.
You send them to the owners. Do you contact the people that have them for sale so they know they are not in compliance? The real estate dealers.
You know, Bill,
Realtors.
I try to, I don't always get a good reception. And
Well, that doesn't matter, does it?
usually when the letter goes to the homeowner, they get that first certified letter, they contact their real estate agent.
Okay.
And I'll tell you, yeah,
That's good. They
So-
need to know it because they can't be out there trying to
then
do it
they
and not know it, and then all of a sudden it's,
know, and because they've gotten into the habit of calling us, and Delana spends a lot of time sending the septic information out for
To the
them.
realtor,
Mhm.
okay, good.
Yeah, and that's actually how we've caught a couple, cause they'll call and say, can you send the septic information on this property? And then we go in and it's like, there's no septic.
Uh-huh.
So
Whoops.
part of this, and I think maybe we need to discuss this, some of these are dry cabins, but according to Colorado law and according to our resolution, you have to have a septic. So a few of them are what you would consider a dry cabin. It's an older cabin. If I get a call back from the realtor and they say, nobody's occupied this for 20 years, I make a note of that and I take it off my list. Based on the pictures that I'm looking at, I can kind of determine, or go out and look at the property and determine whether somebody's been staying in it somewhat. So that kind of,
That ought to be pretty obvious too, when they advertise it online, or wherever they advertise it, it might be saying a cozy thing that blah, blah, blah. Or it could say, it's just been vacant for 50 years, good
Right.
deal, flash sale.
most of them usually don't put it that way. But
Okay,
so I'm trying to work with the realtors when they call me. At first, I was calling them all the time, and it got to the point where I wasn't getting a very good reception from them. So not all of them. Some of them are very polite, they're Johnny on the spot. That's what, I think my calls are what's prompted them to start looking into the septic and the size and things
was
like that.
that true with these four?
Huh?
Are these four in that category? Are they, meaning, they've asked for
Yes.
septic stuff,
Yes,
all four of them?
yes.
Okay, good.
So you're sending the information to the homeowner?
Mhm.
Okay, not the real estate agent?
No,
Okay,
no. I was, when I first started this
Okay.
position, I would call the realtors and say, hey, did you realize this? And I'm sure it was different for them. But since then, some of them I have a very good rapport with, some of them, the ones who don't usually list it up front that it doesn't have a septic or whatever, are the ones that I don't necessarily get a lot of good information back from.
yeah, cause we have no power over the real estate agents.
No.
It's the landowners, it's the property owners.
Absolutely, it's
But
their
the
responsibility.
real estate agents ought to care, because they gotta be able to be honest with who they're selling to, they can't
Yeah.
lie.
Oh, they can
Yeah,
lie all
yeah.
day long.
I know they
do whatever
can, but my
want
point
to.
is-
And we don't police them.
No.
I hope that we are out of that business, period.
No, my
No,
point
no.
is, if a new owner comes in expecting there's a septic system there, then the sale's gone, I mean, they're not gonna.
And there have been quite a few, this doesn't include the ones that have sold, and now I've gotten to the
The new owners.
new owners, and they've done something to take care of it.
Good.
We've had quite a few septics put in the last year and a half that, into places that did not have septics before. A lot of them out at Lake Dewey, we really spent a lot of time out there, so.
Yeah.
Still quite a few of them, but we're working one at a time. 12 septics that are, right now, that are too small. And I do get a lot of feedback from the real estate agents in this regard, mainly because they call me and they say, oh, I'm gonna change the listing. So I'm kind of stuck between a rock and a hard spot. They'll go list a house of 7 bedrooms and has a 2-bedroom septic, if they can figure out enough rooms that they would consider
Well, they'd have to have a
That's-
dining room, a hallway, they'd have
you'd
to,
be surprised.
offices, but only 2 bedrooms.
That was probably a little exaggerated,
I
but
know that happened.
it does.
But a lot
It
of
is.
4 bedrooms, but 2-bed septic.
And, yeah, and I'm gonna throw this in here since you said that, because it made me think of this. I'm still trying to get the ALPS regulations typed up that you guys approved. One of the things I would like to add in there is to eliminate our contractors putting 2-bedroom septics in at all. It does not cost them that much more to put in a 3-bedroom septic. We have one contractor, that's about all he puts in, and I've been watching, on the septics being too small, those are the homes, and it seems to be with a few contractors who seem to lean towards a 2-bedroom septic. they're the ones that are selling the house as 4 bedrooms when it's only a 2-bedroom septic, and it just doesn't make any sense to just, cause the same size tank.
For a new house, these are new houses,
Mm-hmm.
new construction.
Some of them, yeah. Or some may be older that a lot of our contractors have been around quite a while.
Yeah.
But I would like us to consider that.
So just make it a minimum across the board, the minimum you can have no 3 bedrooms less, it's gonna be a 3-bedroom septic.
And maybe I'll talk to a few of the contractors, and my intention is to have a discussion with the one that I see the most, because it makes no sense.
And we ought to probably get a real cost difference, because there's some people got their savings out, and there's a guy and his wife that retired, and they only got 2 people.
And,
It's not, you know.
and I agree with that,
It's
maybe
a free
we,
country, and we gotta be careful.
if we do that, maybe we make some exceptions, but I just wanna make sure that, and maybe it's a meeting with the contractors, all of them, to say, make sure you're educating these people, make sure they understand. You don't know what your life's gonna be 10 years down the road, you may want 2 months, another.
And they would be the first one who could show the value of adding 5 more infiltrators and a bigger tank.
And the cost difference.
And see, for this, you can have something that your grandkids can come and live with it.
Yeah.
But you said the tank's the same size for a 2-bedroom as it is for a 4? Or for
No,
a 3?
3.
For a 3,
It's, the only difference is the size of the bed,
okay.
and it's not that many different, it's maybe 8 infiltrators,
Times $15.
yeah.
A little bigger hole in the ground.
And if you're
And a
doing
little
bed
more
and
time to
gravel,
put it in.
if you're doing the gravel,
You can figure a $500 increase in the job.
Yeah.
Yeah.
Or maybe a little more, but that's still, in the big picture, not a big.
Yeah,
we've been trying to catch them and contact the homeowner and say, hey, have you thought about this? But that's an extra step for us. I'd like the contractors, I'd like us to consider just doing 3 bedrooms.
Okay, we'll see, maybe this one we got typed up. All right, thanks.
Okay,
So there's 12 of them, that's it? There's one of those 12.
12 right now.
The same 12, like the one that, dumping on the ground and all that, or is it just, the fact that they do have a septic system that's too small?
those are just ones that I've identified at this point and have not closed out,
Okay.
where the septic's too small. And I'll tell you, I have a lot of them that have sold, and some of them they're selling right and left before I even track down the new owners. So somebody's bought this house and it was listed as 4 bedrooms. I call them and say, or send them a letter and say, hey, it's only 3 bedrooms. This could be the 2nd or 3rd owner that I've sent a message to. That's devastating for these
Just turning them
people.
that fast.
You know, so they're like, well, okay, I'm turning this one into a den. So how I'm handling this, and I guess I need to bring that up, see if you guys are okay with this. If I just bought this house, put all this money into it, and now I get a call saying I gotta go spend a bunch of money upgrading my whole system, because it's probably gonna take that in some cases. If they're telling me that they're going to turn one of those rooms into a den or anything other than a bedroom, then I have them send me in a letter saying, this is what I'm going to do, how the use, I'm only gonna have 3 bedrooms in use, and I'm going to use this other bedroom as an office or whatever. And that
That's on
goes in the
record.
file.
That'd be fine.
Cause I just can't, then I remind them, you know, be careful of your usage, we talk about how to be septic smart, things like that. I just can't see making somebody who just purchased a house and didn't understand, yes, they should have done their due diligence, but these people that are buying these houses at this point right now have probably never been on a septic system,
Yeah,
so.
yeah, that's probably the majority of our people that are moving here
Yeah.
in the last couple of years, they're all moving from the city.
And I mean, I just, if you guys are okay with that, I'm gonna continue doing that, but those I can usually work with and close out right away. It's,
I mean, again, there's so much, and it's, as long as it's not, yeah, I'd be okay with that. And just document
yeah.
how many of them
They have
like
to
that.
send me a letter signed saying.
Just document it, it's in the
Yep.
file, and it says 3 bedrooms, it's a 3-bedroom, or if it says 2, it's.
Yeah,
And, and any time down the road, if there is a complaint or a guy wants to come in and make a bedroom, you can say, hey, sorry, I didn't.
right. At least we're covering ourselves.
That's right.
and
Mhm.
Trying to work with them.
Sure. Okay, what's the next two?
And that's all I have from a sanitarian standpoint. The rest of this is kind of both sanitarian and contractor issues. I don't know if you wanna wait and have me talk about this when we get down to, I'd asked her to put contractor issues on there.
Well, it's your report, you probably ought to do it up here.
Just do it now.
Sure.
Okay.
Cause that'd be a break in Sarah's stride, so.
Quickly amend the number.
Yeah, that's, that probably should have been done in the first place, cause you got issues with contractors on septic systems, apparently.
Well, I have it on the agenda.
Yeah,
Yeah, I know, that's what I mean.
yeah, let's jump right into it.
Yeah, let's do that,
Okay.
that's no reason not to.
All right. I put 3 examples here. I could bring a stack of examples. The failed septic down in San Isabel, I think we need to make a decision, and Sarah, I haven't had a chance to get with you. But my question is, how do we go about, or do we go contact the state and have them do a soil sample? This particular issue I've been working on since 2023. I have both sides, both neighbors on each side call me regularly complaining about the smell. We've tried, we've sent her multiple letters. I went down, we cease and desist the residents. I knew she was inside, the deputy that was with me, we both knew she was inside, she just hides inside and won't come out. Dan wrote a letter, tried to follow it up from that standpoint to take her to court, and she would never come out and accept the being served.
Well, how did Pat's septic pass it then?
Hello.
Without being there.
Hi guys,
Yeah,
Hi.
have a chair there,
sorry I'm late.
go ahead, sit down. Grab it, grabbing the agenda, this is, for the record, who are you?
Brian Corrigan.
I have questions about that as well. I had a conversation with Pat himself after he supposedly did the inspection. Then later on, when it came back around, I called and spoke to, I believe was his wife, his secretary, we'll say. And she told, kind of let the cat out of the bag and said she never pays him, he didn't even go down there.
So who asked him to go, the lady after she told her to, or?
She asked him to come down after I sent her a letter,
Okay,
yeah. And I was shocked that he passed that system. There's been several that I've been very,
So I made, excuse me, didn't mean to interrupt you. I made a copy of the executive summary on there for,
we're not even there yet.
okay,
So just have a
anyway,
chair,
just FYI.
thanks.
after we did the cease and desist, then she got another contractor out of Pueblo. He was not certified in Custer County, however, he was in Watts certified, so we made an agreement, the 3 of us, the landowner, the contractor, the septic contractor, and myself stood down there. He did a full inspection of the system. He pretty much felled it right there, but he didn't tell her that. He said, I wanna go back, I wanna print my pictures. He was telling me this on the side. There's no way, he said there was no way that system would ever pass.
So who asked him to come?
She did.
She did.
The homeowner did. Since that time, and I think I got interrupted and didn't finish my whole synopsis of the situation. Since that time, she has fired him. So nothing ever proceeded past the failed inspection. He's been very great to work with. I told him, he's welcome to come up here if he wants to take a test.
Was the expectation that he would repair it, or was that the thought they were gonna go fix it?
In his report, he stated that it needed to have a brand new tank. It's a holding tank, it's only 500 gallons, there's 3 individuals living in the residence, they have a washer.
So they're
It's
just
filling
overflowing
It's filling up in
it. It
a
was
week.
set to be pumped all the time.
Yeah,
Except that it's got a hole in the side.
Except for that.
I think that at one time, originally, when it was built, when her husband built the place, it was a summer cabin. And now he's gone
So
and
they're trying to do full-time.
she's trying to live there full-time.
Okay, next step. So you asked Sarah, so you all are gonna work on how do you go to the next step, right?
And I guess my question with this is, how do we, when I read the ALPS regulations, basically this board needs to make the decision whether we can tell a contractor they can't do business. My concern with this gentleman he did not fail a system that didn't even go do the inspection.
Okay, so we have 2 issues.
Yeah.
We're trying to, so there's 2 things we need to take the next step. The next step
That's
is
why I
what do we
said
do
it
with her
kind of-
first? And then do we do something against the contractor doing any business in Custer County?
Yes, so that's why I was saying it kind of bleeds together, the 2 things. So maybe we can get together at a later time and sit down and decide what we need to do. I don't know if that's even an option to have them come down and do an evaluation on that soil, or do we go get the sample?
That's a good question. And I think we should ask, and we'll just start our new policies and procedures, and I think us meeting regularly anyway is gonna be
Yeah.
wonderful, so.
Yeah.
Yeah.
Okay,
Sounds
so
good.
next meeting, we'll have a report
Follow
on
up.
where the status is. And we can hold a meeting sooner if it's necessary. We can have a special meeting just on that issue.
Okay, perfect.
And this will also include the septic contractor in that. So there's 2 issues that you're gonna come back with. 'Cause I don't know what we can do from that point of view. We've never done that before.
Okay.
That I'm aware of.
It's in the ALPS regulations, and I'll bring that,
I just
specific
mean
verbiage.
procedure, process, and let's see what we have to do.
Okay. You know, the other issue, that I'm dealing with that's very large right now is a young couple came and purchased, it's the next paragraph, came and purchased a house. Their house is, infested. They're apparently have been trying to live there, and they decided to put an apartment above their garage. They, didn't come they came and got they built a garage with an apartment above it, had a contractor do it. They did not pull the proper permitting. They're on 5 acres. They never should have put an apartment above a garage on 5 acres.
When did they do that?
It's
Before your
recent.
time or recently?
This one's recent. It is, the contractor turned the permit in on October of 2022 with a drawing that did not show living quarters above that. When the assessor went out to do something and noticed it, and we went out together then to do a walkthrough, got a hold of them, they were like, come on out, didn't know any different, didn't know they couldn't have it. I really believe, now, they should have done their due diligence and done their homework and found out that was not the case.
So they claimed that the contractor told them it didn't matter.
That's what they're
That's
telling me. So after I'm looking at this, when I was at their place, let me back up, when we were at their place this week, I brought their file, we went through this. The, young lady who signed the permit says, that's not our drawing. That's not what we thought was turned in, that's not what we have, because it doesn't show anything. So she showed me they have other plans that he had given them. He's the one who turned the septic permit in. And I kind of see where he put in his address. He also, I'm assuming, crossed out, I don't know, making the assumption that he crossed out that it would not have plumbing. She had marked that it would have plumbing, and he crossed it out. On top of this, the landowner hired a plumber out of Canyon City who came up and did a modification to the septic. The septic system runs, I'm guessing about, I didn't measure it, about 200 feet at minimum from the garage to where the septic was tied into. It is a slope, so I think we're good there. However, he put a T in, instead of coming into the septic itself with another dwelling, he put a T in using, and he was not using Schedule 40 pipe. The pipe broke at one point when he was putting it in, and the homeowner took a picture of it. He sent it to me. That's the only reason why I know that he used the wrong pipe, because the homeowner took the
Was it
picture.
just a straight T blasting into it, or was it turned into it?
I'm not 100% sure. I
Why
believe it comes in, it's kind of, I don't know what you call it, the main top pipe's coming out of the tank, and then it tees from the house.
Sure, I get
and
that.
The other issue I have is he didn't pull the septic modification permit because he's not a contractor here. He used the wrong pipe. They, what else was it?
So they never pulled a permit on that either.
So it's on Grouse Circle, is that up on
Oh.
Oak Creek? Where is that?
Oh,
I'm wondering why you got somebody out of Canyon.
out
It was
past,
closer.
it's out in Rosita,
What's in Rosita?
yeah.
And that was
I wanna
kinda
say
crazy.
out that way. So the other concern that I have with them using the pipe that they used, the majority of the pipe that comes from the apartment over to the septic tank is under a driveway.
And
95% of it's under a driveway, so they're driving over,
How deep is it?
I don't know, cause I
You
never
don't
gotta
even know.
look.
and it's light pipe,
Hmm,
and it's light walled pipe.
yes, it is, save money.
Works with the,
I called the
Freezing.
plumber while I was there, cause I was shocked. When I got to looking at everything, I called him, and he was quite rude. He was very defensive. I've now sent him an email, and I'm gonna send him a certified letter letting him know, letting him know what's wrong with what he did, and asking him what he's gonna do to fix it. Here this couple's out thousands of dollars. Granted, they should have done their homework, but the
that was in
plumber,
2022 you said, or 23? When was that?
they first pulled it in 2022. They just finished the garage
Okay.
and apartment.
Looks like the plumber was recommended by the contractor.
Yes, I called and asked that
Both
just to
out of Canyon.
clarify. Yes, and the neighbor up the street just let that contractor go, the building contractor, and I haven't talked to them, so I don't have any specifics. But this couple said that this contractor is doing things behind the county's back, if you will, without getting the proper permitting, skirting through the rules.
So
And-
bottom line is now we have an issue where you have to come back to us with the proposed fine and process of who you're gonna serve and how to
Okay.
serve it.
Okay.
You know, we get it, it's,
The way I
they
read
screwed it up.
the way I read the ALPS regulations is that we would propose it and then you guys would vote.
Right,
So those are just a few examples of what I'm dealing with. This was those two were the biggest ones,
okay.
so that's,
No other sanitarian things? Nobody's
no, that's about it.
dumping anything on anybody's property today?
Not yet, that I know of. Turkey bones, maybe.
Or turkey, yeah.
Find
Let's,
out.
let's see what you say in December. Any other questions, guys?
I believe so.
Okay,
No,
Thank you,
George.
Dorothy.
Thank you.
Are you guys gonna discuss, can I ask a question?
Sure.
Are you guys gonna discuss the sanitarian position later in the meeting?
No.
Okay.
On the agenda. When you're ready to do that, put it on the agenda. We'll do it.
I'm fine with leaving it the way it is, so.
Okay.
You had made
We're
that
just, we're
comment,
just
and
following your call.
Okay.
Sounds like you two can get together. I mean, now that we have a new employee,
Yeah.
that's twice I've said that today. Glad the door's closed, Beth can't hear me giving you trash.
All right, now Sarah is up with her report, and she's got 3 topics here: epidemiology, EPR, and goals. And you've got it structured that way.
Yes.
Okay, you're up.
Okay, so we do have a new member to Custer County Public Health Agency, very tiny,
he
but
is.
demands a lot of time, very cute.
But very happy.
Exactly. His name is Henry, so he arrived on September 10th, surprisingly, so that's what's been keeping me busy since then, so had to highlight it, start off with something fun.
That's
so.
good. I understand you've been to work already.
Oh, yes, he's right there by my side, Huge asset to the county. Good moral support too.
That's
so.
good.
So you're saying you need constant supervision.
Yes. All right, so moving on to our epidemiology. So I have since met with our state epidemiologist. She's now in our region. Her name is Samantha. She's been helping us create policies and procedures for things like animal bites and rabies collection for testing and things like that. We have had quite a bit of dog bites is the most frequent animal bite that we've seen this season since about June, July. 3 kids were bit by dogs and they were domestic pets. So this kind of shows a little bit of a trend. Maybe we can reach out to the Kids Council or the library and host, an educational session on, let's not pet strange animals. One of these incidents happened off of Main Street. A child was rollerblading and then got bit by a dog that was being watched by a group of young adults. So it's, I think, an educational opportunity because we saw such a frequent trend here. So just to keep you updated.
Trend up here.
Yeah.
Up here. No.
Yep. This is all in Custer County.
Okay.
So it's just interesting, and I've been discussing with the sheriff too, maybe some educational pamphlets that we could hand out to both people who's, if it is a domestic pet, here is what you do as the pet owner, or here is what you do as the bite victim. So it keeps everybody educated and on the same page, which then helps us with our follow-up calls. How are you doing? Why do we do this? How dangerous is rabies? What does rabies look like? Just to really keep people informed, because everybody's kind of confused. Like, they know to report, but they don't understand the follow-up. So I see an educational opportunity there that we're going to work on. Pertussis.
And they gotta know shots might be involved, and there's a lot of.
We track them down. That's the first thing I have to ask, when domestic pets are involved. Hey, can you provide a rabies vaccination certification? Because that really helps us with the disease tracking, and reassuring the bite victim, like, hey, they are vaccinated. This is, we're okay, that type of thing. So yes, that's a good question. But some people are better about getting records than others. But 2 out of the 3 we got records for, so it was really, really nice. But there was another dog bite that bit an adult that was a stray dog. So the sheriff's department got called out of there too. So we're just gonna try to tighten up our procedures to make sure that, sheriff, being per animal control, is doing things safely too, to protect them as well, because rabies is no fun and it's very expensive to treat. So that's another big caveat, that if rabies is detected, it's a huge process. The state gets involved. They have to go to the emergency department to get very painful injections for their first round, and then continuous injections and things like that. So it's a very big deal, and we're trying to host an educational event at the library probably in the spring about this topic to also bring awareness and help the public get informed.
So let's make sure that we talk to the 2 towns, because I see more and more dogs off their leashes all the time.
Okay.
It is ordinance in both of them, and then help me remind the tourism board that when we put stuff out there during the springtime of the year, those who are visiting, hey, keep your ant dogs especially leashed and under control. And we probably need to get into what is a service dog, what's Colorado revised statutes for our restaurants, whatnot, all that jazz.
Yes, and one of the dog bites that was for one of the kids, and it was on the face, was a private business down near San Isabel, and they've had previous complaints, and it's The dog owner was very nice and forthcoming with the rabies vaccination thing, but this is not the first time that I've heard that this animal has encountered. So I tried to discuss it with the dog owner. Hey, maybe this dog needs to be muzzled. Maybe this dog does not need access to the public. I understand it's a working property dog, but it has now, and like I said, it was to the kiddo's face, and the child was visiting from Denver, I believe. And so we had to coordinate cross county lines and things like that. But yeah, so I think definitely some education, absolutely. Okay, pertussis or whooping cough.
Can I ask a question?
Sure.
Wait,
Do you know what the reservoir for rabies in the county is?
The reservoir, so
The animals that have rabies that the dogs might get it from?
skunks, whatever.
Right, things like that, yes. So we offer testing. It depends, your more frequent. Skunks is one. Things like the bats, of course, is another big one that we test. Raccoons, I believe, is one. So we are working through our rabies testing process because we can take the smaller animals like the bats, because you have to take the whole bat to test. But larger animals, so say like a cat or a dog that happens to be dead and needs testing, we have to find a place to be able to decapitate that animal safely. So we are working with the Department of Wildlife and Pueblo County to try to figure out what we can do for those larger animals that are potential rabies carriers.
Okay, so has your testing shown any rabies indigenous?
No, we have not seen any. We've tested 2 bats and 1 bull, and no rabies so far that we've seen. So, but that's a good question.
Okay.
But yes, and that's a thing too. When to bring an animal in for rabies testing is a great educational opportunity that, like I said, we're going to try to educate the public on because we've had a lot of questions. So.
Pretty good topic for the school, have some assembly on, be part of something else.
Absolutely.
Worth looking at.
Awesome. Okay. So pertussis whooping cough is on the rise in Colorado. There were 6 cases in Pueblo. So whooping cough affects especially our little bebés. So your young children, your immunocompromised adults, things like that, and can be prevented through a Tdap vaccination, which we carry at all times. So just to keep people aware, all the fun germs going around. STEC is a type of E. coli. This was an outbreak, you guys probably heard it in the news, from the McDonald's sliced onions from Taylor Farms. So Pueblo didn't have any cases, we don't have any cases, but they are keeping an eye on that because the E. coli is a pretty nasty bug. And then, of course, our nationwide H5N1 surveillance. So this is your avian flu. You can click on this link. And it'll show you all the cases that are in Colorado and the bulk testing that is being done on the milk from the dairy farms. So we here in Custer County are low for concern. The state did contact us to see if we had any large poultry or dairy farms. The only thing that we had was a larger goat farm, but they are not concerned about transferring it to goat milk at this time. They are looking for specifically dairy cattle.
Did we not have a fairly large batch of chickens out in Valley Floor a year or 2 ago, or is that still?
We
in
did, and I
operation?
don't know if that's an operation,
Yeah, they're looking really at like commercialized farms. So you're really, really large poultry.
like 100,000 plus.
Yeah, we're talking big
Chickens.
time. Yeah, and
Yeah, this one wouldn't be that big, but pretty large for Custer County.
do you have a contact?
I just remember that was a
We'll
topic
come
of our
pick you up
discussion.
sometime, we can
Or
drive by
cruise.
where it's at.
Okay, cool. Yeah, we could definitely reach out. The biggest thing that the state is recommending, so they're doing this bulk testing for the milk, just trying to stay on top of it, making sure there's no, human to human transfer. So what we recommend, and what the state is recommending, is that people just get their annual flu vaccination. So this helps prevent mutation and gives people protection. So those, agricultural workers that are potentially at risk, get your flu vaccination is what's recommended. And they're still providing 4 weeks of preventive equipment. So if you need, or if somebody feels the need that they're a large enough operation, they can contact the state through this link and find resources there too. So. Yeah. Okay. Well, this one's fun. So our vaccination rates. I was out for all of this fun stuff, and my nurse, Deb Carl, organized and provided all of this. So she did 5 off-site clinics, which was wonderful. So our main clinic, which is in the school, in their multipurpose room, she vaccinated approximately 87 residents. So we had some volunteers that participated in that. We are seeing a decline in attendance in those. I feel like people are wanting the more one-on-one consults. So we'll still continue to do this, outreach clinic, but it's been interesting over the couple of years, the numbers have declined. So I don't know if people just don't want to gather in a large area type of a thing. So we're kind of watching those numbers. We did provide Wetmore, the senior center, and Valley with flu vaccinations. Valley also had COVID vaccinations provided on 10/16. And then we will be offering it to the school staff on 12/5 to try to help reduce our rates in the school, because it's been pretty rampant the past couple of years. So that'll be happening soon. She has done a total of 602 vaccinations for 375 people, and this has increased since last I've updated this, on her own. This is amazing that this one nurse has done all of this. She is quite the asset. So I wanted to brag her up quite a bit. We are promoting.
That was who?
Deb Carl. She was my interim.
Yeah, I saw her yesterday and she was busy.
She's amazing. So we are trying to revamp our 317 program. So this program is for the uninsured or underinsured population. So if anybody has a question, so this goes for, so VFC is purely children. So this is for adults who, may not have the coverage for a shingles vaccination or a COVID vaccination. So if somebody is looking for a vaccination and they fall into these categories of uninsured or underinsured, have them come to us, say, hey, I'd like to talk about the 317 program, and we can offer them, this is completely free and state provided vaccines to them. So a program that we've always had, but we haven't really advertised it. So we're trying to put it out to the public so that we can get people the vaccines that they want. Awesome. Then we move on to our emergency
But
preparedness.
before you do that,
Sure.
it worked, but I asked Mr. Corrigan to talk about the avian flu, or did he talk with you?
I haven't had the opportunity, sorry.
And I know did you
Hello.
talk to Deb?
Actually, I went over to, my apologies for being late. I thought the meeting was with the BOH. And I'm not getting around too well these days, but I did put together some information here. Bill had asked me to do a little research on possible things coming at us in the future. Now, in 1996.
And it fits right in with what you just said, Wyatt.
Yeah, perfect. In 1996, a number of investigators were hired for 3 or 4 different reasons, and I included my CV in there so you could get, a lot of people know me as the wizard, but actually I have 50 years as a private investigator in the Silicon Valley. And so we were retained to go to the coroner's office and investigate. When you get a coroner's report, there are usually 5 or 10 causes of death. And right in the middle of the avian and the swine flu, we had a number of people that were dying in big numbers. And basically the coroner was just checking off boxes that said they died of the swine flu or
This was where?
Yeah, and so.
Where was this?
This is
Which
in
corner?
Santa Clara County.
This is some time ago.
Yeah,
Okay.
yeah.
You're just giving some history.
Yeah, 96.
Okay.
And so we would go and just verify that there just weren't checking boxes and that was the primary cause of death, because they had an incentive, because they get paid by the state and by the government for those deaths in the hospital. So in any event, I put together a list of all of the potential viruses that are lingering in our environment here, and a number of suggestions only as to how we could prevent having something sneak up on us. Now, in the executive summary and in the report itself, I listed maybe 20 different things that are coming at us. We have monkeypox, obviously, as Sarah said about the influenza. Now, one of the holes in the process that I discovered when I was investigating this report is that the way things go is somebody gets sick, they go to the clinic, they give them this 4-plex test that gives 3 kinds of flu tests and 1 COVID test. of an unknown variant. We don't know what it is. I interviewed the Savannah, who runs the lab in the part of the Rockies hospital, and she basically had no idea what variant they were testing for. You need to have special equipment, which you guys don't have in the BOH, in order to be able to analyze the tests. So I talked to a fellow named Alex Taylor who sells these tests. And basically, he said he had no knowledge of what they were testing for. They were just like a blanket test. So what happens is there's a hole in the process. People go to the clinic, they get tested, HIPAA requires they get the results, but there is no gathering of this information. It's completely out of your control. And so when I tried to dig into that and drill down on it, they just said, sorry, we can't give out that information, but they can give us the dynamics of it and whatever statistics they're allowed to provide. I think we should have some source for that in the Department of Health. I mean, it's just my own thought. So we have monkeypox, malaria, Zika virus, dengue fever is in about 10 or 15 states now. West Nile tuberculosis, avian influenza, and a whole ton of other things. Now you mentioned Ebola, but the big thing about what's going on with milk and dairy products now is listeria rather than Ebola. Now listeria, basically, I did die of it back when it was on the honeydew melons or the cantaloupes. I just happened to have one, and I got it, and I hit the hospital, and I flatlined in the emergency room. But
When was that? Some time ago?
yeah, that was 6-7 years ago now.
So you know the process.
Yeah, and but basically, I guess they gave me the zapper, and I was 3 or 4 days in a hospital bed, and then I just got home and started everything again, But the listeria is absolutely a cellmate of the Ebola. And so I think we should include that in your overview. And a lot of these things are very esoteric, a lot of the illnesses, but my suggestion is that we create something on the website. Oh yeah, one thing I noticed when I was going through the website is there is no link from your old website to the new one. So I would suggest that maybe Vernon or someone could actually provide a forwarding so that when somebody clicks on it, they don't have to go down through and find out your new website address.
We need a whole overhaul. It's in my later presentation as one of our goals is to revitalize our social media platform. So I appreciate that comment.
Well, actually, the website, the new website is amazing. You have so many referrals and a lot of great stuff on there. I'm very proud to see that as a tech. But I think we should have links to outside and off your website, and then also have a link going from your old website to the new one. I think that's important, because a lot of people don't have the sophistication to scroll down and to cut and paste the link for the new one and all that stuff, especially older folks. Now, getting back to the hole in the process, so somebody basically has to be able to gather up statistical information on these random people that go to the clinic, get tested, and basically go home and within 2 weeks they're okay. The new version of COVID is very mild. It's more or less like a flu virus, but we don't even know what they're testing for with this 4-plex test, what flu viruses they are. Now, my research...
Is it in all clinics, Brian, or is it just part of the Rockies as an issue?
Well, I called around, the other clinics wouldn't give me any information. I contacted one in Pueblo, and one of the clinics that does outpatient emergency, those things.
There might be somebody that the public health, work with Sarah and you guys can team up on.
So what I'm thinking is, so I have a meeting with our state representative for our epidemiologist actually next week. So what I will try to do is ask her these questions and to see if they can give us more detail on, be more familiar with this type of testing and if we can collect further.
Just so you've got the record and we know what's out and what could be coming or not.
Mm-hmm.
Yeah, we can get a dartboard on this stuff and kind of throw the dart at it and see which ones are prevalent, which ones are in states close to us. And there has to be sources and databases available to us to be able to tap into that. Now, your website has a lot of great links on it, and I'd suggest that maybe that would be a great baseline. that you could use for people's research, so they could click on it and they could see what's going on around us. But the Listeria and Ebola, they are sisters and cousins. And I think that the avian flu right now seems to be H5N1 is the most dangerous that I've seen in my research. It seems to be in all the states around us. And anyway, so I.
And nothing here yet.
Nothing here
in the
yet.
state.
Not that I had any information on.
That's good.
Not that I've heard, so.
Yeah, but that might be something that, now Savannah's, now all this information is in my report. Now, bless you.
Thank you.
I put my CV on there so you get an idea of my experience when I was working as a private eye in Silicon Valley. And I have tons of information about insurance companies that I managed. And I was a regional VP for Progressive Insurance and Zurich Insurance Company. And basically, the research I did on these diseases, you could, target those and just have some kind of an alert system set up. And if you start seeing anything in adjoining states, or even through statistical research that you can do, it might be good. So in the executive summary, I tried to just concentrate on the different holes that I saw and the processes going on. We need to have communication with the clinic. And we need to have some kind of feedback loop set up with the DOH for when, like, if they get 5 people in that come in that are just randomly tested, and then they get the results, go home and get better. We need to have an idea what that is, because there could be a very dangerous flu in there somewhere. And if they die outside of a hospital, then they will have an autopsy. If they die in a hospital, there is none. And so that's just kind of the procedures that the hospitals have. And I work closely with the CDC when we were hired to go and do this evaluation, and got a lot of information on the epidemiological transmission of the avian flu and how it actually gets into all of these systems that we have that are not being monitored. Like, for instance, you were saying about the larger farms. I think the smaller farms are actually the big problem, because they're not well taken care of, they're not monitored. And when a chicken dies, they get called and they're sold, or they have them for dinner, whatever comes first. But I think that having some kind of lines of communication with anyone with poultry or other issues that are related to Ebola or Listeria, I think would be important. And I can tell you that Listeria, I had 24 hours of diarrhea, sorry. And I had
Thanks for that.
not a drop of liquid was in my body when I hit the emergency room, and that's why I had that flatline. And anyway, so there's a lot of great information in here on the various diseases for easy reference. I had my AI partner go through it and come up with some information. And I'd be more than happy to show you how I cracked AI Chat 3.5, and you can go in there and get all kinds of great stuff for guidance. So, Sarah, if you want, you can come over to the shop, and I'd be glad to sit down with you and show you on my computer.
Well, thank you.
And, all right, so now that you know a little bit more about me, and feel free to share amongst yourselves on my background, I have a ton of experience in a lot of different fields, and I'm glad to share that. And I'm here to be a resource for you and nothing more. You guys are doing a great job from what I can see.
Yeah, thanks, Brian, and it's an asset, and he did help us tremendously during the COVID as well, setting up processes so we could get the shots done in Lang Hall.
Yeah, we set Lang Hall up, and I worked with Adrian, and we actually kept people in their cars. And if somebody had a bad reaction, they would come in, and I personally bought 21 beds, cots, towels, and all kinds of stuff that's in the Lang Hall, so we have that as a resource in the future.
For the agency to kind of work with.
Well, fabulous. Thank you so much. It's very nice to meet you. I look forward to conversations.
Yeah, anytime, I am.
You've been busy, and he was around sooner, but now you're back, and that's great.
Yeah, I've been a volunteer with BOH for a long time, and with the Office of Emergency Management, so I'm a resource if you need me.
Sounds awesome. Might have to recruit you for our MRC, our Medical Reserve Corps volunteer group.
Oh, I'm already in there, I
Oh.
think,
Excellent,
yeah,
wonderful.
I got my badge and everything.
Perfect. Yeah, we're gonna start updating those too, it's on our to-do
That's
That
what
was
list.
the
the
only
system
reason
worked.
he got it, so he could get his badge.
Although what happened was, somebody didn't have badges, so they just put it on the back of something else and ran it through the machine.
Oh, jeez.
So
All right, well, thanks,
it's
Brian.
kind of a crappy badge.
Okay, now the fun generator.
Yeah, so I'll highlight, we did get to deploy our EPR trailer at Airfest, which I thought was an excellent
You
success.
had a good presentation, I liked it.
We had lots of fun. We had prize giveaways. We had our volunteer groups present and, trying to gather some more volunteers and, our lovely advertising of all the programs that we have. It was a really wonderful experience and I hope we get to do it again next year. So big success there. That was the first active deployment for our trailer. So big deal. Yes. With our.
Thank you for inviting me to your meeting, I'm sorry to interrupt you, I'm here if you need me, you guys.
Thanks.
Thank
for coming.
you.
God bless you all.
Thank you.
So yes, our emergency generators, as you see here, though, next to this picture, this is a Jackery, so that is our battery powered. We also have 4 gas powered. So not to confuse, this is not a generator that's gonna power your home. This is meant for medical equipment only. So, things like a CPAP or a oxygen concentrator. We wanna make that super clear because this is not, it's about yay big. So it's not gonna, not a lot of juice, so enough to get you by. So what we're trying to figure out is the best way to deploy these pieces of machinery, how to keep track of them and things like that. So what we'd like to do is have it go through our first responders because they're able to get out 24/7. If people know prior, they can try to contact our office and we can coordinate with those individuals. But essentially, it's gonna hopefully go through the first responders. So we're gonna have a lockbox on the outside of our building that they will have the code to, and the generators will remain outside so they can just grab and go. Is what we envision. We're still trying to hammer out the details, but it's gonna be, it's a really potentially life-saving program that we would like to see utilized. So we have not gotten to deploy one yet, but we're waiting. So if anybody, knows of anybody, especially in the public, spread the word. These generators for medical equipment. So just getting the word out is half the battle, so.
They can use, Jim's what she's pointing out.
Yes, and we do have to put a 2-week maximum use on it. So usually, dear goodness, if we get a snowstorm that lasts longer than 2 weeks, I'd have to consider moving. But we do try to give them a generous amount of time to utilize it until things resolve or we can get other resources in there. So that is that. We are having a regional drill with our hospital district in Pueblo, February of 2025. They haven't given a specific date or topic yet. They're trying to choose a topic that is not fire related and a different topic. So this is looking at hospital bed availability. So if we have a disaster, how are we going to coordinate between all the counties in a disaster? What's the hospital's capacity?
What's the region include, which county?
So Pueblo, Canyon, us, and I think that's it. It's just the Southern Hospital District, the acronym is HRSSCO. It's very long, but yes, so Pueblo, Canyon, us, pretty much. And you're looking at your bigger hospitals, St. Mary Corwin's, Parkview, and things like that. And we're hoping to tie in, especially for us being so small, but getting the barrier from Hardscrabble or out Oak Creek Gradeway, getting our people down and out. I'm really hoping that we get to be very active members in this drill so that we have a clear transportation, because that's our biggest hurdle, I feel like, especially in a disaster, that we get heard and, they know that we're here and they service us, so.
Yeah, because we have no beds in Custer.
Yeah, with
right?
no beds.
So no beds.
No beds. And that might be something too that we can bring to the table for, HRMC. There's things called swing beds. So if they have like a small, your ski resort towns that have a small, it's not like a major hospital, but you have
clinic, basically.
Right, and they can do, so the swing beds are like, okay, in a case of emergency, or just to stabilize and then get the patient down, or you can use those beds as like rehab beds. So again, bigger conversation with our hospital district, I think, needs to happen to increase our resources here, especially in a disaster. So that is that. And again, as I mentioned to Brian, we are looking for more MRC volunteers. So I don't know if that would be interesting to you. So MRC is Medical Reserve Corps.
He's very familiar with it.
Fantastic. We are looking for people. So again, tell your friends. We're a fun group and we do a lot of things. And we'd like to expand those activities throughout the county. Okay. So substance abuse grant, STEP grants. So these are, so STEP is the tobacco, and substance abuse obviously is your opioid funds and things like that. So there are some new programs that are trying to come out to help reduce tobacco use. So that's the first one, the Second Chance and the Catch My Breath. So this is for if kiddos get caught with tobacco products or vape tobacco things, that it won't be so punitive. It's an educational opportunity. So right now, some of the punishments are pretty harsh from our school district. They get suspended right away. So this is an opportunity for them to learn about, why is tobacco dangerous, alternatives, things, resources, to try to educate the youth. And in addition to that, Patrick is going to try to go over and provide substance abuse lessons. So why are drugs bad, things like
On the
that.
cigarettes, do you have one for adults too? I mean, adults want.
That's a good question. So I'll ask Patrick because these are.
Applying it to a different group to get them, because if the adults stop, it helps the kids not do it either.
It's a really good point. Or it could be a potential program that we could do in the future. So I'll ask, because
Right.
sometimes these grants get really specific
Why not?
about age groups
That
and
would be
things.
the key.
So I will ask Patrick to follow up on that.
Is it the same for vaping as it is for tobacco products?
Yes, and the reason why you don't see as many cigarettes is the kids can hide the vape products easier, because they don't, again, it's a higher nicotine, which is really scary. It does a lot of damage.
I've heard them getting killed by a lot of this poison.
Yeah, you're talking like, one inhale is like 7, it's an insane amount of nicotine that goes into this. And that's why those jewels got taxed, and there's additional grant money there.
Okay.
Yep, so it's, a lot of education that can be done, because they don't see the after effects, and they haven't been around long enough for a lot of studies to provide what happens.
Long-term effects and all
Exactly, so.
I see they're putting nicotine in the little pouches now. They used to, where they had the pouches for the tobacco, the chewing
Yeah, they just put a
Now
pouch
they
in.
have just nicotine patches.
Just making it easier to hide, which is just, it's scary business, so,
The only advantage to that I can see is, it's supposedly the regular snus has some fiberglass in it that makes it,
Oh, it made you, yeah.
get it transfer bigger.
yeah, cuts
Isn't
the
it-
cuts the
it's in a
gums,
pouch,
the
it doesn't
blood
do that.
It'll
vessels.
decrease your gum line.
But that's why I think people lose their whole face off of that.
It's,
Big time.
yeah, and those nasty spit bottles, oh my God.
You just swallow it, keeps your worms out.
Oh,
It's a Kevin Day dewormer.
there you go. Gonna patent that. Oh my goodness. So yeah, and so Patrick is gonna get into the school systems now and be the new face of, and really getting in there and teaching kiddos about these things and being more involved, which we're really excited to strengthen that relationship with the school.
Good.
He has new naloxone carrying kits. They're in like a hard case. He was going to try to, he's out for medical reasons at the time, but he's got these hard cases now that zip up. They're really nice. They've got a resuscitative mask, gloves, and then of course the naloxone in the kit. So he's working with the bus drivers to try to get those kits in the buses for school. But anybody, on the go, I know he's working with the sheriff's department too, but if anybody has a need that they could see having one of these carrying kits.
So working with them means teaching them how to give them a shot.
Kind of. So the lovely things is the naloxone is nasal, so it's all up the
This one.
nose. Yeah, so
It's
no
not.
pokies. Yep, up the nose. Much easier, less dangerous.
So it's a little smaller than our wall kit here.
Yes, so it's compacted into like a hard, almost like a pencil case, kind of, about yay big. So they're very nice looking, and it just says naloxone with a big red cross on the front.
Good.
So, but if anybody has any other additional high risk communities that we're not serving, we'd love to know about it so we can get them the resources.
Okay.
Patrick has also been taking over our CPR instructor courses and our AED program. So we're trying to develop throughout the county, which it's already started, but we're trying to maximize its potential throughout the county. So strategically placing these AEDs, because these pieces of equipment they need regular maintenance and they need to be, they're expensive. So we have to use them tactfully. So we're trying to make sure that all, county buildings have them, first responders get them, but at the same time using them, we're not over, giving 20 away unnecessarily, because we have to keep them ideally temperature controlled because of the batteries and the pads. So if they're kept outside, it can cause damage to those and the machine might not work as effectively. So we are in the process of trying to get a hold of that and what that looks like moving forward for the county. So making sure we get our money's worth for sure. We have started our CPR instructor training. I actually got to do this before I left. We got to go into the Custer County School District and train 8 staff members. So that was fun, being very pregnant and performing compressions, but.
Oh, I see you said in August, not next August, it was last August.
Yes, it was this previous, this most recent August. We've also been working continuously with Valley Assisted Living, so as they need, we provide instruction for their new oncoming staff. And we just solidified with Wet Mountain Fire a very large class, so we're talking about 25 to 30 people with all their volunteers, happening in the new year. Probably, I believe it's January 2nd is the tentative date, so that's going to be a large group of folks. And again, anybody that needs it, please send them to us and we will coordinate a class.
Road and Bridge goes with, they have a 2-year cert for their stuff, for first aid as well as CPR. So I don't know if that might be something to visit with them on, or if they're gonna, I think lately they went through CTSI.
I reached out to them prior, I think it was in the summer months, and they said they were all up to date, but I'm more than happy to reach out to them again.
Yeah, so, and they may be staying with CTSI because they finished that training as well, but I know there was a time when you guys had done that for Road and Bridge.
Yeah, absolutely. Any county entity. We ourselves in public health actually are going to do HIPAA training for all employees, CPR and AED for all employees starting in the new year in January. So we're going to get our people caught up as well. So more than happy to reach out to Road and Bridge too. Awesome. Okay. Our next grant is the Maternal Child Health Grant. So our WIC program engagement has been up 50% since the last year, which is amazing. That we've really, our outreach programs, we're speaking at the library, we're going to do these events with Envision to tap into more of our county and getting people the resources that they need. So WIC is Women, Infants, and Children. So they serve pregnancy to age 5, which is wonderful. So nutritional, it's supplementation, so they can go get healthy groceries and things like that. So they come to our office once a month, it's on a Wednesday, to service our people in person. And they have even talked about, since they've had such a great engagement, that they might even come 2 days a month, which is even better. We are looking for further grant opportunities with the Children's Health Fund. So they already supply, so this little boy is wearing sunglasses provided by the Vision Grant that the Children's Health Fund gives us. That was a new outreach to advertise that we have these grants. He's doing a great job. So we're looking into things like, we used to do sports physicals. I talked with a nurse practitioner who would be willing to perform those. So I'm looking into seeing how large of a need there is to ask for that amount of money to see in this public, because I know that was a very popular service that was provided and then has since gone away.
That was a big deal, and that was very good. Even way back in the 60s, the welfare department was doing that, and the doctor did it for them.
And I think, being that it's hard to, sometimes it's hard to get kids into an appointment or down the hill,
Right.
Hey, or we want our kiddos in sports. So we need all the bodies we can get.
Keeps them healthy and out of trouble too, so that's worth investing in, so yeah, that's a good thing, personally, in my opinion.
Wonderful. And again, they have been very, I mean, we have a lot of opportunity to do different programs with them. So we've even looked into getting like a medical grade breast pump. So breast pumps provided by the insurance companies aren't the greatest in my personal experience. So I would like to get a medical grade breast pump to be available to any new young mom, because again, I found through personal experience that it is impossible to get one. So right, something I didn't think I would come across, but we're starting to see more young families, so it's such an important incentive. So again, things like that is what we're looking for, these funding opportunities, just trying to gather, again, more needs. So if anybody has any ideas, please send them to Public Health. We are really trying to expand our services, especially for our families. So, and we're increasing referral rates and connecting families to resources. So things like StarPoint, are you guys familiar with StarPoint? So they're an early interventional group.
Heard of it, I don't know anything about it.
They're great. Yes, they're based in Canyon, but they do come up and service our folks in home for free. So it is a non-income based. So if your child meets certain qualifications, from ages 0 to 3, and there's like a weird thing before their 3rd birthday, it's 60 days that they have to make sure they're in the system, and because then it transfers to the school system after that age, or it goes private. So they have been super fantastic. They came and presented at Custer County Kids Council to inform about their services. They have physical therapy, occupational therapy, speech therapy, feeding services, and I believe they're trying to onboard a dietitian so that they can get nutrition involved. So really, we're trying to, make people aware that these resources are available. So again, if people have questions, please call us, and we are working on getting a nice solid referral network to things that people need. All right, so we are planning our community outreach for 2025. So we've been talking with, of course, the Envision Good Health that does the quarterly events at the Pines Ranch. We are also working with the West Custer County Library about our monthly meetings. We may tweak those a little bit to see if we can do a couple of combined ideas rather than one idea per month, just to make it more effective for the county. And again, this is another opportunity. Airfest was a great suggestion last year. Thank you, Commissioner Kanda. So again, if you guys hear about anything that you think Public Health should be involved, please send us an email and we will jump right on it. And then, of course, so starting off the new year, here are a couple goals that my department is really trying to focus on to improve public health. So as I mentioned to Brian, we're trying to revitalize our social media platforms. So our website, our Facebook, really this community really likes those platforms. So I'd like to streamline, regular posts. The sheriff does a great job of posting regularly. So if we can learn from who is ever posting for them, I would like to do something similar for public health. Just to keep everybody updated on things like epidemiology, or we're having an event, here is grant opportunities, things like that. We are consolidating and focusing on our core services. So there's in our world, there's a lot of grant opportunities. Some are big and some are small, and some of the small ones, they're like $5,000, but you've got to put a lot of manpower into it. So we're really trying to focus more on our main services. So the grants that I've presented to you today are epidemiology, our emergency, preparedness, mother-child, things like that is what we're really trying to focus on. So we have a really solid core service. Then we can look into expanding into other programs. But we want to solidify those. And we're actually having a grant workshop for our January staff meeting, where we're going to take apart each grant. Everybody's going to look at their hours, what funding sources, so what we can utilize those grant for. Can we buy kits to test for COVID? Can we do this? Can we, how we best can use our grant dollars.
Okay.
So, and then, of course, strengthening our community partnerships and our inter-county relationships. So like Dorothy brought up, I'd really like to have regular meetings with Dorothy and strengthen our relationship. I actually just got to briefly meet with Robin from OEM yesterday and catch up there. So really trying to, as department heads come together, same with the sheriff. So I don't know if we could do that as a county-wide incentive where us directors could meet. I would really like that, because public health goes into a lot of different little avenues, and I think that we can support each other better if we meet on a regular basis. So,
Absolutely.
all right, and then this falls into the new business, so I don't know if we're ready to transition to that.
Whenever you're done.
Okay, that's it. Unless you guys have any other questions for me, or from the audience, if you have any questions.
No questions, just a suggestion with respect to your website and Facebook updates that you were talking about. When you post information about whatever, for instance, epidemiology, make sure that you vet that information and that it is indeed reflective of the actual scientific data that exists. A lot of what we heard from your guest speaker was not. So I would just advise, for the benefit of the county, make sure you're telling them the true information.
The state has a lot of really good resources, so like, he was talking about some hyperlinks, so what I like to do, even in my presentation here, it's a hyperlink direct from CDPHE.
Yeah, or CDC
Or exactly.
someplace that has the information you're trying to talk about. But not, I'm afraid that some of his hyperlinks are going to certain less reputable places.
This is information, I have to review, this is,
Check, and that's
yeah.
why it's important for it to work.
yeah, this is brand new information, so I absolutely will take my due diligence and review everything in great detail. Appreciate that.
Awesome, okay.
Okay, so now, are we doing contractor issues first? What's on your,
So the contractor issues was.
well, wait, I'm sorry.
Yeah.
Yeah.
I was like,
Already been done.
not me,
Yeah,
Yeah, forgot
But-
to move it out of the
but
way.
yes, so then,
Okay,
but then.
public health vehicles.
Yes, so as you guys are aware, we have a van, a Trailblazer, and a Ram. So the van is pretty much inoperable and unsafe, so it's just kind of rotting where it is right now.
We just put a new lift in it. What-
Put a
Not
used
work.
lift.
Is that a used?
It wasn't a new.
We put new or used parts in a used lift, I think, right?
Yes,
There,
which is against ADA compliance for vehicles is what I was informed of. So unfortunately, we are unable to utilize that right now. The Trailblazer, again, these were vehicles obtained before my time, so I'm not sure how we obtained them or what exactly went on, because there's not a whole lot of paper trail. There's some maintenance here and there, but the Trailblazer is, the air conditioner went out. I've only used it one time when I was heading to a meeting in Pueblo, and the air conditioner went out, and it was summertime, and it was awful. And it's probably more expensive to fix it than, to find the funds to fix it is gonna be, is it worth it? So I wanted to bring before the board, what can you advise me? What would we like to do? And maybe this is more of a BOCC question, I'm not sure, but I wanted to get,
no, it's our, if we
It's
don't
us.
want it, then we can turn it over to the county and then
Okay.
get something else with it.
okay, so definitely those two vehicles for sure. We really kind of just want to relinquish.
I know nothing about the Trailblazer.
So it's a rear wheel drive, it's got around 140,000 miles on it. So I'm compiling a list of vehicles we probably need to put on auction
Right.
or put out there for sealed bid.
That would be the one,
Okay.
like, what year is it?
I think it's a 2011. It's an early 2000
Caitlin's
model.
putting together a full list of every passenger vehicle we
Good.
have.
Yeah,
Okay.
and I've got a file on it, so I can, if you would like a copy of that, I can send that over.
How much mileage do we pay out for going, because I know Patrick travels a lot, and I know that's paid by some of the grants.
Correct.
Can we change it to fuel, because that makes the grant go further, because we don't pay, if we can, I mean, and I'm looking at, do we need to buy a vehicle or two more and use them as fleet vehicles? Because that's cheaper than paying 67 cents a mile.
For
Correct.
somebody else.
And the wear and tear on somebody else's vehicle versus a fleet vehicle that gets maintenance.
Two-wheel, it's only two-wheel drive.
It's only two-wheel drive.
Yeah. And no AC, so.
And then the
super
van
fun.
was a donation to the county.
That was given to us by the Barfoot, Ann Barfoot Wilson.
But free is not all, free is never free.
unfortunately, and it's gonna, I mean, I'm married to a mechanic, so I'm like, it's gonna cost quite a bit.
What year
finalize
is it?
that.
I'm not quite sure.
I don't know, we'll get the years.
Yeah,
Put it
I
all
think it's a
together.
90s.
So we can deal with that one too, it's,
Thank you.
I know they did their best to try to get it operational, but it's not possible, we can get rid of it.
Good to know. Yes, and that's wonderful. So, yeah, just advise me further on what you'd like to do. I really do like the county fleet vehicle idea. I think, especially for ours, because we do travel for conferences and things like that, it would be very efficient, especially something fuel efficient. That'd be great. So that brings me to our lovely Ram. That's a diesel, and it sits there most of the time, and diesels need to be used and abused. And so I don't know if it would be an advisement, because we still need it to pull our trailer. So we still need to have access to this vehicle, but, I don't see a problem of opening it up for further county use potentially.
We've asked people to use it.
Okay.
And I think, so Road and Bridge has asked for it, I've had the sheriff's office that would like to have it. And so I think for Road and Bridge, it's not the right fit for what they need for a 1 ton or for a heavy duty pickup, but I think between the sheriff's office, OEM and because it's a CDHPE grant that gave it, it kind of restricts what we do with it. So do we use it as a fleet vehicle to pull, public health's trailers, the sheriff's department's trailers, and because they have trailers as well, and OEM, and, we make that as part of
We have to look at that grant, but I can't imagine why they wouldn't allow us to use it for emergency purposes.
Right.
Right,
Any
absolutely,
emergency.
right,
Yeah.
any emergency.
So, and then.
And we just kind of keep it in the OEM emergency
Right.
operations fleet.
And sheriff, et cetera.
Yeah. So Robin and I actually talked yesterday about
So you're
an
gonna have-
MOU
You're gonna have to
between
get-
us.
Well, that or you have to have a process on how you check it out.
Exactly.
And keep track of it and make sure it's
VMS board
maintained.
in on that through.
Yeah, or VMS boards, that's
Yeah.
what pull our VMS boards, it's what's, it's,
Well, we learned yesterday that Public Health in Fremont County has 4 vehicles.
no, DHS.
I'm sorry, that was DHS.
Oh,
That's
okay.
DHS.
Okay.
Don't be spreading rumors that
I was like, wow.
You don't get another.
Dang it, come on.
I was gonna say, they maintain
They got,
those, but
they got
I don't
4
wanna see
vehicles
you
just for their
maintain
admin
it.
staff.
Right,
Yeah.
right,
Yeah, that's right.
exactly.
DHS down there, pretty big outfit.
Yeah, so, and again, we wanna be, a resource to the county and things like that, and again, that truck needs to be
So do
driven.
you wanna take the lead then, you ought to get an MOU together and a process how they're gonna check them out and keep it maintained, somebody's gotta own it.
Sounds good, we can do that.
You can
And then-
recommend giving it away.
Caitlin maintains the 2 fleet vehicles we have here,
Okay, so
So-
maybe you and I need to work on that, I think that'd be great.
so conference, whatnot, and give me true report back. Reggie's probably used them the most to go to Denver,
Mhm.
and they're getting old, so, even though they're low miles, we probably need to
Maintenance, or,
we probably need to go with some newer ones that give us the safety features, the little more power, a little more better fuel mileage, so.
yeah, and if it falls under the county's fleet, then does the county pay for the maintenance? Cause I know maintenance under
It does.
diesels
Yeah.
is expensive, so,
Yeah.
okay, perfect, just wanted to make
But
sure.
it has to be booked, you'll have a piece of the action and so will the other process.
So-
And how
So speaking about the Ram, that would probably still be your lead on the maintenance on that.
Well-
Or depending on how that's set up, because
I think
somebody's gonna
that's-
have to pay for the fuel and the
Well,
maintenance.
it would be in her
So I think
budget,
it's,
but it would be.
I think it's a separate conversation for the BOCC. Maybe the BOCC takes over that vehicle, it's part of
A fleet.
Caitlin managing a calendar of who's gonna use that vehicle when, and we get,
And we're gonna share
fuel keys,
Oh.
so that, it's always full, they bring it back full, and they just use the amount of fuel that they use for their specific purpose.
I brought it back full, although when I got it, it was a little under 3/4 of a tank.
Oh.
That's why we call them daddy warbucks.
So, and that's part of our emergency services, is that the vehicles always come back full, so at any time, there's a full
Gotta be able to have
emergency.
that.
We're ready to
there's-
deploy.
We're
Not
ready to
sitting there on
deploy,
empty.
so.
And
So I
that's-
think maybe it's a bigger conversation, once we get a total of every asset we have, what do we wanna auction off or seal bid?
Did you guys locate your second set of keys?
I haven't found them yet. I know they're somewhere.
I
I'm
gave
like,
them to you when I turned in
I
the
know,
truck that
I'm
day,
trying
and
to
you gave
deter-
me a ride,
I'm
so-
trying to
Put it in
determine,
a
I remember
drawer. I
that
thought you
day.
handed
That
it in
was,
a drawer over
that was
there.
very close to birthday, so I'm like, I know they're around, so we are actively looking
Okay.
for
I
that
think Bill
pair.
knows where they are, or not Bill. Who was it? I don't remember who.
No, I gave them back to Sarah that day,
Sarah
and
had
that's the
them,
set that disappeared, not the other set.
Oh, they had, right, there was the.
There was two sets.
Yeah, we've got two. And now we have a interdepartment too. We have a lockbox for all of our keys too. So all of our vehicle keys, until we determine what we're gonna do with them, will be in that lockbox. So that's what came out of that. So,
Okay, health
yes.
staffing.
So I would like to, and I'm not sure, I'm new, so I wanna know if this is the process that I go through. So I talked to HR and he said to bring it forth. I would like Deb Carl to be moved to full-time. So she's part-time right now. I'd like her to be moved to full-time as the clinical programs lead, to be made effective in January 2025. So what this is doing is we are eliminating the part-time nurse that we had kept in our budget. So this will end up saving the county money.
So what that means is we have to go and, put together a plan.
Okay.
Commissioners can look at the staffing.
Would-
How we pay, how we pay for that and whether it really does save money.
It's, yeah, we kinda have it in the budget as that right now, so,
Going from, so Deb is part-time and you had in your budget for a second part-time,
Right,
which neither one of those draw benefits.
Correct.
But if Deb goes to full-time, at that point,
so it's 30%
Then that-
higher, or whatever it is.
that adds another third on top of the wages as a rule for, the other benefits, the insurance and things of that nature.
Which she
She's
gotta
not
do.
gonna take the insurance, so we've already had that discussion. She would like to collect PTO, but she does not wanna use the insurance, so it's kind of a give and take, and she, like I said earlier, has proven herself, I mean, to be such an asset. And at this time, you know, between her and I being the nursing staff there, we just didn't wanna upset the team balance, having to bring in another on board at this time. And then to consolidate our grants to make sure that, you know, we're using the dollars as effectively as possible. So it's,
I think it's a great idea, we just need to get the details on the, budget, and then, commissioners can approve.
perfect, awesome, so.
You got anything to add to that, sir?
So you wanna go through, cause I got the email. You moving her from part-time to full-time, no change in job description.
So we're actually creating, public health department wise job descriptions for each role. So we are gonna revitalize the previous job. This is a new role. So the previous role that she had taken on was immunization lead, but now she's taking on further programs. Exactly, so that,
So it'll be new, Bob.
I had her down as lead nurse, we have one function or functions. Now you're saying that's not what we're doing?
correct. So she will be taking on additional roles, still in a lead position, but there's additional duties underneath her job description. So she will be the lead on our epidemiology, actually. She's going to be the contact that puts it into our state system.
We just need to look at the job description as a whole. I can't answer just by standing here whether or not.
No problem.
what
That's
that
why I
was.
propose it, get it together, and let's put the package together, and we'll look at it,
Perfect, okay,
see what we make happen.
Think so?
I can do
And when
that.
it is effective, she's not looking at it between now and late on New Year's, probably.
Yeah, I mean, between the, like, the pay period, you know, trying to transition with the new year and the new grant cycle.
Yeah.
So, okay, so job description, excellent, awesome, and then that is all I have.
Darn, we've got a half an hour to go again.
Unless you guys have anything for me, I'm willing to.
Just congratulations.
Thank you.
Welcome back,
Thank you.
so.
And all your grant cycles will end in June currently, what we have, and we're projecting based upon the states or the grant cycles being July 1st to June 30th, that we get those July, when do we hear about those? How much time, I mean, is it gonna be June 15th and all of a sudden we find out, oh, this one have all dropped or have been eliminated? And then we're scrambling for 2 weeks trying to figure out what's our department look like?
It gets tricky. So usually it is, from what I've seen in prior to because I've only been through one like entire grant cycle, it's June, sometime in June, and sometimes the government likes to surprise you, that happens. So we try our best, and that's why we're having this grant workshop, is to really get a hold of our grant figures. So, hey.
Who's the workshop with? It's got somebody
So
from the state?
Interdepartment, so we are doing it ourselves. So it's, Rhonda's coming in and all the people, so like Deb is in charge of X grant, Y grant.
We'll tell you what.
What she's trying to do is since Peggy, since Peggy's got a timeline as to when she's gonna retire.
Hey, you're talking
No.
Rhonda. I was like.
Since Rhonda's got a
Yeah.
timeline, what she's trying to do is take some of that and every person, Patrick Fior, hey, you're in charge of this, so.
Well, what I would like to
So that
see,
you're not high
given
and dry
what
when that happens.
Lucas has said, and it's been a concern of everybody, when do you get it? How do you know? What if it's cut? You get the state to come down, because in fact, they know that we depend on grants. They're the ones that forced us to do it, because they want certain activities to happen, no matter how small or big the counties are. So they need to be participating, and that way we have some confidence that we're hiring somebody, people move, they come in here and we're gonna upset them and have them not get paid for 2 months or get fired because the grant all of a sudden drops. We gotta get somebody to tell us what is the process, and can we have some confidence that we're gonna get the grant, maybe more or less, but, and some heads up on it.
Right, and each grant has a contact person too, and we are usually in regular contact with these individuals. So like, for example, the epidemiologist and then our EPR head grant came down in person. What was that, 2 weeks ago, a week ago? It's all kind of blending, but they sit down, hey, how are you doing on your deliverables? What is money's looking like so far? Because they only get so much of a heads up too, even though. So we do try to stay in regular contact, and having that listed out, like, EPR grant, this is our, Linda Smith is our grant contact. This is last meeting that we had with her. This is how much we have. These are the people that are pulling. These are how many hours that these people are pulling from. So really getting a nice solid hold on it, especially our very, very large grants like those.
Okay.
So, but absolutely, we do try to stay in regular contact with them, but we can see if any of them want to try to attend.
Sure.
Okay.
So,
Anything else?
So we made a meeting schedule, and we're gonna start meeting at All Board Westcliff.
okay, cool.
So I've got the February 20th, May 22nd, August 21st, and November 20th are just the regularly scheduled quarterly. But of course, if we need something else, let us know. Mondays are kind of open, and some of these other afternoons, most of our BOCCs are in the mornings, so
Okay, so we want to keep our 1 to 3 time period?
something like that.
Okay.
And it sounds like that's what.
1 to 3 is
best.
good, and special meetings anytime we need it.
Gotcha.
And we don't have to always meet in the All Board Westcliff.
Yeah, do we rotate with Wetmore still on was it every third
I
meeting?
don't know if they fall on those.
I've got,
Probably
no, I don't have
not.
any of those on Wetmore days.
Okay.
So,
Okay,
no, I tried to leave Wetmore as, that's it, and that's all it's.
Yeah.
okay.
She was really wanting to go down to the kingdom.
I gotta keep in touch, very important part of the county.
Can you do the meeting and then, do your shot clinic?
Yeah, hey, we could do that.
Multitasking.
Hey, all about that.
Anything else?
Efficiency.
Oh, I don't think so.
Okay.
I'm good.
All right, any public comments? Jim?
What do I say?
You don't have to say anything.
Well, I kinda have to say something because I already brought it up a little bit. But, it struck me as very odd, the advice you were getting from your guest that you had today. I'm not aware of any infectious disease, experience he has. He's an expert with viruses of the computer kind. But clearly, from things he was saying, he is of no use in advising on infectious disease. To equate Listeria and Ebola as cellmates or sisters is, suffice it to say, incorrect. They are totally different animals, totally different diseases, totally different modes of transmission, et cetera, et cetera. I don't know what the purpose exactly was. It sounded like it was a advice on agents to be cognizant of as potential threats, and half of the ones he listed are not. It would be interesting to see what was in his report. And that's really, I'm just trying to warn you that if you're going to get outside advice from people, make sure you're getting good advice. This was not. And like I said, I'd love to see his report and
You
give
can
my 2
certainly see
cents
it.
to it. I would also love to introduce myself to you and have a bit of a discussion. But other than that, nice to see you're having meetings again.
Good. Yeah, the intent was, because there are this is flu season, that was the only reason that, and it was, the intent was to have him talk to them first and work with it, but that's her job. She's gonna pick out what expert advice is real or not and help. And we shouldn't turn down anybody that's wanting to offer something if it's real and it's good. That opens our eyes, like, we don't have any bird flu here, that's good to know.
And definitely meeting, so I meet with our state epidemiologist very regularly. She is a huge asset to myself, especially being in this new role. So she is a great wealth of information, as well as the state. And so she's guided me through foodborne illness outbreak. We've covered, like I said, the rabies. We've been really trying to get a policy and procedure for our department, specifically on how we're gonna handle that. And I absolutely have an open door policy. Please come and introduce yourself.
And I know some other folks in the county who have, lots and lots of experience in the same thing, whether or not they'd be willing to, well, not whether or not, I'm sure they'd be willing to hear you out anytime you needed it for various things, so, anyway.
Thank you for coming. It's nice to have
Don't worry, I'm always here.
members of the public.
Even when we're not here.
Yeah, he comes on days that we can cancel a meeting.
He's etched his initials on the chair.
No, but like I said, I should introduce myself and let you know where I'm coming from with respect to Board of Health and other things, so.
Excellent.
But we don't need to do that in public forum.
Sounds good. Thank you.
Thanks, Jim.
Okay, anybody else? Anybody online?
It's just
Is
us,
Vernon online?
just us and Vernon, yeah. That's it.
Okay, hearing no others, I adjourn this meeting at 2:43.
It's 2:39.
No, wait a minute, 39, looking at it sideways. You're right, 39. 38. Doesn't matter.
We're going off computer time.
Thank you, good job.
So